Jaw surgery is required anytime that the teeth don't fit together. Sometimes the teeth don't fit together because not only are the teeth not in the right spot, but the jaws themselves are not in the right spot. So then that requires us to go in there and make a correction of placing the jaws into the appropriate spot. That oftentimes has a lot of other benefits to it, because once we can get the teeth into the appropriate alignment, we often are able to balance the face. So the forehead and the nose and the upper lip and the lower jaw, they all match and they marry together in a much more aesthetic and pleasing way. Jaw surgery can be performed in several different ways. Typically, it's either an upper jaw, so it can be addressed in the upper jaw or the maxilla, in the lower jaw, or in the chin. And those are the three main kind of components or puzzle pieces that we're thinking about when we do corrective jaw surgery. So the upper jaw can be moved forward or backwards or widened. Oftentimes we need to do it in a couple of pieces to make it wider so it fits the bottom teeth. The lower jaw surgery can be performed so the lower jaw slides forward or backwards, and there's a couple of different techniques or ways you can do that align that up. And then oftentimes when we balance the jaws themselves, sometimes the chin is not quite in the right spot either, so we can then slide the chin independently forward or backwards depending on what we need to do so everything balances. In order to determine who's a candidate and what types of movements we want to make, it's a very detailed process where we gather a lot of records. So we take three-dimensional x-rays, pictures, impressions of the teeth or virtual impressions of the teeth to get all of this data together, and then we combine it into a system that we call a cephalometric analysis, where we analyze everybody, and we have about 40 or 50 different points that we kind of analyze on the face and see where all of those points line up against population norms. Each case is tailored specifically to each person, but there is some art to the procedure in that I need to get the teeth to line up exactly like we want them to, but I also want everything to balance very well. Because of some of our advances in our pre-imaging data, I can actually show the patient on pictures and on x-rays what I anticipate those changes will be. We do all advanced imaging through all of our cases to plan them all, and then to do the pre-surgical planning as well. I first bring patients in and we just talk generally about what is corrective jaw surgery. We talk about the risks and the benefits. We talk about all of the different things that can happen with it, and we just make sure that this is something that you are interested in undergoing. The next step is to come in and obtain the records, and that's when we take the models and the pictures and the x-rays, and we get all of that data there, and that's when we determine exactly what we're going to be doing and starting to prepare for the pre-orthodontic setup. And right before the surgery, about 6 to 8 weeks before the surgery, that's when we jump back in, we re-obtain the models and the records, we do all of the preoperative planning. Typically I meet with the patients 1 or 2 times before that whole process happens. Then we do the procedure itself, and typically the patient will stay in the hospital overnight one night, or they may go home that same day. And then post-operatively, I see the patients on day 1, week 1, week 2, week 4, and week 6. And so each of those little steps, we have little goals that we're trying to get through that process. The majority of the healing happens in the first week or 2. After that first 2 weeks, people are pretty much back to most of their normal routines. We still have them on a relatively limited diet, and we're making just minor adjustments to their healing along the way. We work very closely with our colleagues throughout the medical and the dental community. Whenever we're planning any of these cases, like a corrective jaw surgery case, there's myself, the orthodontist, and the general dentist are all in the mix. We communicate frequently between each other, sharing notes and comments and x-rays and that kind of stuff to make sure that we're getting the outcomes that we want. And one of the amazing things about this procedure is that it is so immediate. Oftentimes when people have a big overbite or underbite, their teeth don't come together hardly at all. And so during the procedure, I'm able to move the jaws into the appropriate position and then immediately put them together. Oftentimes when we're sliding that chin forward, we can see it come forward, 13, 14, 15 millimeters forward to really balance or set the face up in a very aesthetic way. Corrective jaw surgery is a real procedure. It's a surgical procedure that we typically do under a general anesthetic, so the patients are fully asleep for the whole case. One of the big things that has happened over the last 10 or 15 years is our advancements in three-dimensional modeling and picturing. So whenever we do one of these one of these cases, every single time that I do one, I do it with three-dimensional modeling. So we have a big supercomputer that we sit down with that allows me to do the exact procedure that I'm anticipating doing on that person in 3 dimensions with the x-rays, so it's personalized specifically to them. And then I'm able to print, or once we make those moves, I'm able to then print out little surgical guides that help guide me during the procedure to get the exact results that we want. So those changes have drastically changed the way we do these procedures and the predictability that we have once we go through these processes. Now, that doesn't mean that the surgery doesn't have any limitations or complications, but it does help us reduce those risks significantly. Corrective jaw surgery is the reason that I became an oral surgeon. I just find that it's one of those procedures that has life-changing effects on people. I've just seen people kind of come out of their shell after this procedure because it is just one of those things that changes people's lives in a very subtle but a very profound way.